The first batch of international travelers under the new COVID rules by China landed at airports in the southern cities of Guangzhou and Shenzhen just after midnight on Sunday. China has just lifted its pandemic restrictions on foreign inbound travels, ending quarantine requirements and the need for COVID tests upon arrival. But in an unexpected twist, some countries have announced fresh testing requirements that only target travelers from China. Are these measures really necessary? Are we in for yet another round of political manipulation? Let's hear what my special panel had to say during this special edition of The Point with me, Liu Xin, coming to you live from the studio here in Beijing. I'm pleased to be joined in the studio by Einar Tangen, Senior Fellow at Taihe Institute, a think tank. From Tel Aviv, Israel, by Gong, Professor of Economics at the University of International Business and Economy. And from Washington, D.C., by Eric Ding, Chief of the COVID Task Force of the World Health Network. Gentlemen, welcome to The Point. Eric, let me go to you first. As I said, China has officially lifted its COVID restrictions on international travel starting on January the 8th. Now, authorities will cancel COVID tests for inbound travelers, and they will no longer ask for proof of a health pass, or travelers will not be put into mandatory quarantine upon arrival. Also, China has also downgraded its management of COVID-19 from Class A to Class B. Some people say it's back to Class B, and one of the major adjustments is changing the name of the disease from COVID pneumonia caused by novel coronavirus to infection by a novel coronavirus. From a medical point of view, why does this matter?
Thanks for having me. Well, I think, first of all, COVID is, in terms of surging worldwide, it's very different than it was in 2020 when we obviously didn't have vaccines and many people weren't infected. So it's obviously, in certain ways, easier in terms of, and milder if you have vaccinations. So if you have vaccinations, it is easier. But the infections do still persist and remain a clear and present problem. I'm not an advocate for the downgrading, because in two worlds, when you have one virus that's more severe, less contagious, or a less severe, more contagious, it's the less severe, more contagious that will epidemiology-wise send more people to the hospital and cause more deaths. And the problem right now is that the global surge of COVID again this winter, especially in China, is going to ultimately send more people to the hospital, even if it is milder. So I don't think you should necessarily downgrade. Now, the mitigations, I understand the mitigations previously in the last 3 years in China were very difficult. But at the same time, dropping mitigations now in the middle of winter, may I add, is actually a really bad idea, especially since China's some of the elderly population is not boosted enough, does not have the Omicron updated boosters, and there is a more dangerous variant circulating worldwide. And that is, I'm talking about the XBB.1.5, the variant that started in the Northeast US. So I'm not an advocate of biased testing. I think we should still test everyone. So I think some countries that test China specifically is unfair, but I think we should still keep up our mitigations, because the deaths, the hospitalizations is still yet to continue building, and the long COVID economic effects and debilitating healthcare effects will continue to build. So I don't think the pandemic is over. I think we should still continue to be vigilant.
Yeah. Professor Gong, let me go to you from an economic, from a socio point of view, from a sustainable point of view. What are the considerations to your understanding of China's lifting or changing of strategy of downgrading COVID from Class A back to Class B?
Yeah, my understanding is that the change of policy is premised upon the medical conclusion that this has a very high R0 value somewhere. I think I thought it was 18, and it was just said by an expert in China, I think yesterday, that it's actually 20. So given that fact, it's just unstoppable. There's no way with the existing measures you can stop spreading this thing. And second, I think even though we are seeing unfortunately, fatalities, especially among the elderly population, I think the overall toll on society, both in terms of death toll as well as the number of infections, is still very different from what the COVID first spread out in 2020, in terms of this lethality. It's not as dangerous anymore. It's not as killing as more, even though it still kills a lot of people. And then also on top of this, I think our economy cannot sustain like this, being locked down for so long. And we look at the fiscal situations in many cities in China, many provinces in China, look at the household income, look at the business status. This policy is not sustainable anymore. So I think it's about time to adjust course. Even though I understand, this is not one of the best times of doing this at this point. We're getting into the winter, and winter is indeed the time that it spreads most. So, but given all the choices, given all the difficulties, given the status of the virus right now, I think we're somewhat forced to make this decision. And I think with the society, various aspects of society's commitment and the government's commitment, we probably definitely will weather through this storm. As a matter of fact, I think in many cities in China we've already passed the peak. So we're in a post-peak era right now. And hopefully this thing should be behind us for good.
We are in at least the first post-peak area. I see Eric shaking your head. I understand you have different opinion, but Einar, you have been throughout the whole period, the last 3 years actually in China, and you've seen the whole thing. I just want to point out that some of the adjustments under this new strategy is not letting it rip, but rather, for instance, diverting resources from prevention and control to monitoring the mutation, from monitoring wastewater, to monitoring individual cases or pneumonia of other possible pneumonia of unknown cause, or sentinel hospitals, and there will also be adjusting test strategies, which means no mass COVID tests will be carried out, but done according to people's needs, and those who are infected will not be quarantined anymore, but emergency measures will still and can still be taken if cases really peak in the future in order to bend the curve. Einar, your understanding, by changing the category from A to B down to B, is China letting it rip?
Well, I think the semantics aside, what China is doing is it's decided when it wanted to open up. And, quite frankly, there are a couple of issues that I saw here. One, very important, was Qatar. You had 4 million people from around the world, including many from China, who went there. Yet there was no repercussions. You didn't hear about pandemics breaking out because they went to Qatar. Now, those people went to all corners of the earth after the World Cup. So right now, I think a lot of people looked at that. Certainly the public looked at that. They saw throngs of people in the stands and not wearing masks, people on the pitch, hugging each other, sweating on each other, shouting, all of these types of things that would normally be, verboten in a pandemic situation, but you haven't seen anything. And I think the Chinese government also took notice of that. Now, I understand Eric's point about, and agree, that the best thing is to make sure that everybody has a vaccine. But doing a vaccine push, especially with the elderly at this juncture, would not have been fast enough. If you can get to that 65, 68 to 70% infection, where people are on, you have in essence brought people to a basis where 6 months from now you can start administering boosters. But the question is, how do you get there? How quickly can you do that? And when is the best time to open up?
From your understanding, I mean, from my understanding, people are still taking precautionary measures, right? I mean, pretty much everybody is still wearing masks, and that is advocated as well. Einar, very briefly.
Yeah, I mean, it's not like people wandering around. What was interesting is during the first 2 weeks when the Chinese government said, look, we're reducing the threat level here, there was very few people on the street. In fact, it was similar to if they had imposed a lockdown. And this is one of the main differences between China is that and other countries is that culturally people have a very strong sense of responsibility. So they didn't want to go out because they didn't want to get infected and they didn't want to infect others. So people are taking reasonable precautions. There's always going to be some stern and drum, but if China is able to get to that 70% rate, which it has done in the major cities, and yes, there will be some more waves, but within a few months or less, maybe just after New Year's, you're going to see a remarkably different China where they can go on with both the medical and economic side.
Pretty much already I see a lot of normalcy back on the streets in Beijing, for instance. But Eric, you were shaking your head. And also, please respond if you want. And I also want to talk about the variant, the new variant which you talked about, which is the XBB.1.5. That seems to be the lips of a lot of people, although right now officially China says it has not detected a massive community spread of this new variant, which has a much bigger immune escape, as they say. How much danger does that pose to the mainland population, although it was first reported in the United States last October?
Yes, I want to address the, people who say once you get to 65, 70%, they're basically implying some herd immunity. And it's been 3 years of the pandemic of experience. People said we're herd immunity after spring of 2020, herd immunity after winter of 2020 and 2021. Herd immunity after Delta, herd immunity after the first wave of Omicron, in which a lot of people were infected. But the thing is, reinfections continue to happen because of the virus and its mutation and its variants. So you'll get a temporary respite and relief for a couple months, but that just buys you some time until the next one and the next one. And so you have a burn through, but then it'll burn through again with these new variants. And for the example, the variant XBB.1.5, WHO said it's the most transmissible variant currently, and it's for two reasons. One is the highest immunity escape that leapfrogs, that pole vaults over existing immunity from either vaccination or previous infection. And if it can do that, it's again the escape score is incredibly high. It's 90, 95%.
It was first detected in the United States last October,
yes,
and it was spreading everywhere. But it seems that it has not been the prevalent variant in Europe.
Well, that's because China, because this is a variant that its specialty is reinfection. China, in certain ways, has virgin fields of lots of uninfected people. So in China, BF7 or other variant is just as good right now because China has virgin fields uninfected. XBB.1.5 is a reinfection variant, and it's reinfection of not only escape but also high penetrance because it actually has one of the highest ACE2 binding, fusion with human cells. So you may say we might have a respite in a couple months, first of all, I remind people that the Lunar New Year travel is coming up, and the Chinese cities have had burn-throughs, but the rural areas, which have even less hospitals, will have another wave. I want to remind people. And secondly, this reinfection potential means you bought yourself 2-3 months, but so what? Once XBB.1.5 or another variant afterwards comes back, it will have another cascading wave. And that's what we're seeing in Europe. Sweden is a record high deaths again, UK and US. It's all going badly again.
From a scientific point of view, that is an ideal situation to keep, strict control, but from a sustainable economic point of view. But Einar, I want to let you go in here.
That's Eric. I want to address that point. Basically, you're saying that China should go back to this kind of zero COVID idea.
No, and not zero. Like there is an in
well,
between.
Is there? Where's the in between?
Zero.
You're just saying that this is an reinfection variant, and there's really no no defense against it.
Basically, China is trying to take a compromise. Yeah, go ahead.
China does not have, I would like to remind.
Well, a Chinese company has just announced that it has developed a messenger RNA vaccine. China has 13 different vaccines, and it has been stepping up vaccination of the older population. John, finally, to wrap up on this, do you have something to say before we move on to the next set point?
Well, I think both Anna and I are not advocating for doing nothing about potential waves. I think, I think absolutely Eric is right that, we should get prepared with better vaccines, more vaccines, as well as medications. I think probably we are seeing more and more advances on the medication side. But I think, you just mentioned that the old policy is not going to be sustainable anymore. It's not going to be sustainable economically as well as politically. So I think at this juncture, I don't see any other choice but to move ahead with this adjustment that we have to come back to normalcy, that we're not going to be intimidated, we're not going to be locked down by this virus, no matter how many variants it has in the future. I think at the end of the day, this virus is very different from it appeared in 2020, early 2020, and it's no longer like the beginning of the COVID time. We're going to be in for a long period of sort of post-COVID era where these viruses will come back again, but not as lethal as they used to be. And it's something that we cannot go back to the old situation anymore.
All right. Well, let's talk about the kind of restrictions that some regions have announced about inbound travelers from China. The United States, for instance, issued a statement on the December 28th of last year that travelers from China will need to have a negative COVID test taken 2 days before departure, citing rising concerns over China's lack of transparency over its outbreak, as well as its failure to adequately track and sequence variants within the country. Eric, is that going to make a difference? I mean, we know in the United States the dominant variant is the XBB already, and there are 1.1 million deaths according to Johns Hopkins University, and over 100 million cases already.
Yeah, I think for the travel restrictions and the testing restrictions, I think there is a lot of bias. I think there is a lot of COVID worldwide, and just merely testing China is unfair because there is a lot of COVID in Europe, a lot of COVID in the US. And again, I openly admit that the XBB.1.5 is a US variant, although XBB was originally a Singapore variant, so which went to New York and then became XBB.1.5. So we should have like comprehensive testing. Now, quarantining, we should obviously, it's very difficult, but we should have repeat testing upon landing for international travelers. But we should at minimum have international testing for travelers, but not in a Chinese targeted way, because right now there are a lot of virus even outside of China, and to single out China is somewhat unfair.
Is there a scientific explanation as to why the XBB.1.5 is not as explosive in Europe as in the United States, if the spreadability is so high?
It just started in the U.S. first, Northeast. It hasn't even spread to all of the U.S. Western U.S., Southern U.S. It's still surging.
But it's the prevalent one now.
The epicenter was in but it's England. It's rising. In Central Europe, it's also rising. And it will rise because it's like 120% advantage over BQ variant.
So the European Union also issued recommendations strongly encouraging its 27 member nations to require negative COVID tests for travelers boarding flights from China to the region. According to the statement, the member states agreed on a coordinated precautionary approach in the light of COVID-19 developments in China, especially considering the need for sufficient reliable data and the easing of travel restrictions by China starting on January the 8th. But the European Centre for Disease Prevention and Control said on January the 3rd in a statement that the variants circulating in China are already endemic in the EU region and as such are not challenging for the immune response of EU citizens. So a surge in cases in China is not expected to impact the COVID-19 epidemiological situation in the EU. John, from your understanding, the European CDC is saying this, but European recommendations still recommend COVID testing or screening from arrivals from China. How do you look at this?
Yeah, so Liu Xin, you exactly make the point. The thing is that the potential risk of brought by Chinese outbound tourists, its impact on European societies as well as American societies is actually very marginal, precisely because the virus, the version of the virus coming from China is an old one, and in these societies, it has already developed the herd immunity to this. So that you're not going to see, massive infections as a result of this. As a matter of fact, it's going to be very marginal. And this is actually also the risk of the virus is actually not the reason, at least Washington is quoting as a reason for imposing this required test. The reason is because so-called lack of transparent and adequate data. Well, so so they know the medical reason for doing or not doing this, but it's mostly for a political reason. And my argument against this position is that at this point, I don't think many societies, many countries are still actively tracking these cases as they used to do. So what it means is that, of course, the data is not going to be adequate as it used to be. So what? I mean, you don't have adequate data from China. You don't have adequate data from many European countries. You don't have adequate data from the United States, as well as from many other countries around the world. So why that could be quoted as a reason for imposing these tests? So this is I'm very uncomfortable with, and I can understand from a sort of a political perspective. It requires reciprocity. Still, Chinese inbound travelers are still required to take a test before boarding onto the airplane. If that's the reason, it's okay to say that's the reason. But if it's quoting sort of like a other reason under pretense of a medical justification, that's just unacceptable to me.
Einar, what is your take of the reason of the excuse that the U.S. at least is citing is a lack of transparency or reliable sufficient data?
Listen, that's purely political. It's another attempt to one of the daily attempts to try to contain China. It has a strong racial bias element to it, but. I think Beijing needs to be careful about responding to this kind of nonsense. The fact is, China doesn't have to be defensive about its policies. The fact is, the world has chosen to coexist with COVID, and they're going to go forward. You can say, well, they do this, do that. Yes, you have to take precautions. Obviously, vaccines are incredibly important, but as Eric pointed out, even with vaccines, there are still variants that get around them, so you have a reinfection risk. But the fact is, we are, as a world, now going forward, hand in hand, with this idea that we're going to coexist with something that is not going to go away, and it's going to have to dealt with on a daily, weekly, monthly, and yearly basis.
I don't know which one of you can answer this question about data, because right now it is difficult to get complete data as China does not carry out massive COVID tests anymore, and the best you can have is sampling or from the sentinel hospitals, as I just mentioned. So how can China step up the work in terms of collection of data and reporting of data to its international counterpart, be it the World Health Organization or other international or other governments?
Before Eric responds, I just want to say, if China reports inaccurate data, there will be a massive pile-on by the US and Europe saying that somehow China is trying to deceive the world. I think quite clearly they've said they're going to look at excess deaths, which is really the only way that you can measure it, because it's not just deaths from COVID. It's also people who die because they couldn't get to the hospital, or they were afraid to go, or didn't take care of chronic conditions. So, I mean, that is the most accurate way to do that. It has not been embraced, despite the WHO recommending that by Europe and the United States. There have been independent studies that have been done suggesting that the death tolls are much larger than things just purely from that point of view. So if China does that, that is the gold standard in determining what the effect COVID has had.
All
so
right.
I'll leave it to Eric.
Anybody else? Yeah, Eric.
Well, I think, first of all, excess mortality is incredibly important, but I also point out that, first of all, COVID causes more deaths than just direct respiratory failure. And China's current definition is way too narrow. And every expert agrees it's way too narrow to just count a direct respiratory death, because COVID causes a whole slew of diseases, from such as clotting diseases, stroke, heart attacks, and many other diseases. And again, if the hospitals are full and someone dies of a heart attack at home, unrelated to COVID, I would still say that is a pandemic-induced death because hospitals are overloaded, right? And so you do need to kind of count broaden the actual direct cause definitions.
I get your point. Yeah, John, do you have a word here?
Well, yeah. Well, I'm not an expert in this area. I mean, from a medical sense, but my understanding is that, for every death, there could be multiple reasons, and COVID could be one of them. So the issue is, if we really want to be scientifically very precise about this, we have to trace back, the most important reason. And this is a very difficult case, actually. For every case, you go and trace back, what's the ultimate reason for this. It's like, trying to find whether smoking is ultimately responsible for lung cancer. And, it's a tall order.
That's
and,
a good analogy.
so I think at this point,
this is what you do in epidemiology.
We don't have to.
Yes, lung cancer. Lung cancer can cause someone's death. Yes, lung cancer causes death, but smoking also causes death.
Right.
And this is what we do in epidemiology. And also in death certificates, you can have the direct cause, but also have multiple underlying causes. China right now is muzzling the underlying causes. And again, if you don't want to have your relative cremated immediately, you would have to report to the provincial government, for example, for many, many weeks for that to be. And many people don't want to do that.
This is a very difficult issue, and this is an extremely complicated issue. I understand the authorities are doing the work. The reporting system is functioning, and let's give it a little bit of time. Eventually, I think people will want to know the most reliable answer, so that nobody is misled and it reflects the reality. Finally, I just want to ask this very small question. I have 2 minutes left. The International Air Transport Association, or IATA, issued a statement on the imposition of travel restrictions on travelers from China, calling the kind of restrictive measures extremely disappointing. It says several countries are introducing COVID-19 testing and other measures for travelers from China, even though the virus is already circulating widely within their borders. So it's extremely disappointing to see this knee-jerk reinstatement of measures that have proven ineffective over the last 3 years. Eric, in terms of the damage from XBB, for instance, should Europe impose some restrictions on travelers from the United States?
Well, I think the rules, I don't believe, some people say no testing. I think we should still continue to do testing. That's my belief. Not that we shouldn't isolate China, but we should still have blanket testing. And also, China could also report the variants in its country. And if it doesn't, then obviously testing can help capture that. So I think, China can report more variants, and we should have testing worldwide.
All right. I understand China is doing that. China has communicated with the World Health Organization 4 times at least since December. And of course, we'll keep scrutiny on that process. Many thanks to Einar Tangen, John, Gong, and Eric Ding joining us from Tel Aviv, Beijing, and Washington, D.C. With that, we come to the end of this special edition of The Point with me, Li Xin. As always, you can follow me on Facebook and Twitter using the handle Li Xin in Beijing. Thanks for watching. On behalf of the whole team, you've got the point.